The field of neurosurgery has evolved to using more minimally invasive technology and less destructive modalities to treat a wider array of conditions. The wider array of conditions that we're able to treat include movement disorders, epilepsy, chronic pain, migraines, and neuropsychiatric conditions. We are able to treat more of these conditions now due to the array of technology available to us and using neuromodulation. Neuromodulation involves non-destructive therapies to treat a wide array of neurological conditions. With the improvements in technology, we can place leads into specific parts of the brain or the nervous system to treat a wide array of conditions, and the goal is to do this without causing newer problems or destroying normal functioning nervous tissue. With neuromodulation, we can alter pathologic networks in the brain and treat these underlying conditions. We now have information about which areas of the brain are known to be perhaps hyperactive in certain disease states, and we can place leads into these areas to silence these parts of the brain and return the patient to a more normal functioning network. So in neuroscience, we've learned over the last so many years that different diseases are actually alterations in the entire networks in the brain themselves. And we're learning that the network itself is altered in different disease states. And by having advanced functional imaging, we can see which aspects of the network are actually disrupted in different disease states. Using this information, we can then target that specific part of the network to return the patient back to normal health. New and upcoming indications for neuromodulation include chronic depression, Alzheimer's, and other neuropsychiatric conditions such as Tourette's. There's a lot of active research going on in these areas currently, including major clinical trials to see if neuromodulation can help with these diseases, because they will present a severe burden on society as the population ages. The hope is that we can treat a wide array of conditions that we don't have great treatments for right now outside of medical therapy. As the field continues to evolve, we can hopefully intervene on some of the conditions I had mentioned before, and also newer neurological disorders that we don't currently have great treatments for. I think our imagination really is only limited by the science, and as basic science increases and our understanding of the nervous system increases, we're going to be able to intervene on a wider array of conditions. The future of neuromodulation at Montefiore incorporates building a multidisciplinary program. We're working actively with our colleagues in neurology to build a stronger movement disorder center and offer surgical treatment options to patients in the Bronx and the Lower Hudson Valley. It's often difficult for these patients to reach out and get access to this therapy, so we're glad to be able to offer that. And on the other hand, we're also working with our colleagues in the psychiatry department to expand our research into neuropsychiatric conditions and see where we may perhaps intervene with neuromodulation.
Great. That was great.
Currently, there are conditions that are not amenable to neuromodulation, but I think that's only because of our limited understanding of the brain and the networks involved. As our understanding of these networks expands, I think we will see a lot more therapies utilizing neuromodulation. There's work actively ongoing with the Department of Defense looking at neuromodulation for a wide array of conditions, even soldiers coming back from war. And so I think in the next 50 years, we will see neuromodulation become major therapy, and it's really only limited currently by our understanding of the brain itself. Neuromodulation, I think, can have a tremendous impact on a wide array of neurological and neuropsychiatric conditions such as Alzheimer's and major treatment refractory depression. the conditions are currently impacting a large portion of society, and there aren't very good medical treatments for these refractory states. As the population ages, the number of patients who have Alzheimer's and the burden that places on society will continue to expand. And if neuromodulation can even intervene on a small portion of that, that can have a huge impact on society and perhaps reduce the overall burden on society and caretakers overall.